imagine you go to the doctor, right? And you've got this like shooting electrical pain in your feet.
Yeah, that classic pins and needles feeling.
Exactly. And you probably have this set script in your head of what they're going to ask you. Like, you might expect them to ask about a recent back injury or maybe screen you for diabetes.
Right, the usual suspects.
Yeah, but you probably do not expect them to sit down, look at your chart, and seriously ask, what brand of denture cream you use.
Oh, definitely not.
Or if you've recently swallowed any pennies. Or even if you take a daily over-the-counter multivitamin.
I mean, if they did ask those things, you basically think you were in the wrong office, right?
Oh, totally.
Because we are so conditioned to think of nerve damage, what we call peripheral neuropathy, as, either a mechanical problem like a pinched nerve, or just the result of a very well-known chronic illness like diabetes.
Right.
But those obvious causes, they're really only covering like a fraction of the landscape.
Mm-hmm. Which is exactly why we are taking you on this deep dive today. We are exploring the hidden and honestly, sometimes completely bizarre world of nutritional neuropathy.
It is a wild topic.
It really is. We're basing this on a truly eye-opening comprehensive review by Dr. Neeraj Kumar, MD. He published it in the October 2023 issue of the medical journal Continuum. And it fundamentally changes how we need to think about the nervous system.
It really does. Because, we tend to visualize our nerves as this static electrical grid. Like once the wires are laid down, they just sit there and conduct electricity.
Sort of wiring in a house.
Right, exactly. But your nervous system is actually this highly dynamic living network. It requires a relentless, incredibly specific supply chain of vitamins and minerals just to, maintain its basic structural integrity.
Right. And the mission for today's deep dive is to understand what happens when that supply chain breaks down or gets actively sabotaged.
Yeah, sabotage is a good word for it.
Because when it does, your nerves literally begin to starve. They start misfiring. And what we found so striking in this research is that, the starvation isn't just happening to people who literally don't have enough food.
Right.
It's happening after common surgeries. It's happening because of recreational habits. And weirdly enough, even because people are trying to be healthy by taking supplements.
And to make matters worse, when the peripheral nerves in your arms and legs begin to fail from these nutritional deficits, they rarely go down alone.
What do you mean?
Well, the peripheral nervous system is intimately connected to the central nervous system, so the spinal cord in the brain. So a failure in the peripheral nerves often signals this massive systemic collapse.
Wow. Which I guess brings us to a concept that completely flips our traditional understanding of malnutrition.
Oh, the modern malnutrition paradox.
Yeah.
Yes.
Because, when you hear the word malnutrition, you naturally picture someone who is visibly underfed.
There.
So I was initially really tripped up by the premise that someone who is technically obese, who is, consuming a surplus of daily calories, could be literally starving their nerves to death.
It's a massive clinical blind spot. First off, the research points out that obesity itself is a recognized metabolic driver for nerve damage.
Even without diabetes.
Completely independent of diabetes. The constant state of metabolic stress and low-grade inflammation just takes a toll on the peripheral nerves. But the plot thickens considerably when we look at how obesity is actually treated.
You're talking about bariatric surgery, like gastric bypass.
Yes. So bariatric surgery is incredibly effective for weight loss, but it's not just about shrinking the stomach so a person eats less.
Right.
Procedures like the Roux-en-Y gastric bypass, they physically alter the anatomy of the digestive tract. They fundamentally reroute the plumbing, basically, to bypass specific sections of the small intestine.
Right, and those bypass sections happen to be the exact doorways where crucial vitamins and minerals enter the bloodstream. So even if the person is eating super nutrient-dense food, the biological loading dock has just been permanently shut down.
Yeah, the nutrients just wash right past.
That's crazy.
And the numbers really reflect how serious this is. The review cites a Mayo Clinic study showing that a staggering 16% of bariatric patients eventually develop peripheral neuropathy.
Wait, 16%? That is a massive number for a surgical complication.
It's huge. And looking at the clinical notes, the timeline of when a patient starts, stumbling or feeling numbness actually tells the doctor exactly which loading dock is failing.
Oh, that's fascinating. How so?
Well, your body doesn't store much thiamine, which is vitamin B1. The tank is very small. So if bariatric surgery suddenly stops thiamine absorption, the patient will develop a severe deficiency very early on.
Like how early?
Sometimes within weeks.
Wow.
Yeah. But conversely, we have massive reserves of vitamin B12 and copper, so deficiencies in those might not surface until years after the surgery.
Okay, but the surgery doesn't just cause chemical problems, right? The paper mentioned this bizarre mechanical complication tied to the rapid weight loss itself.
Oh, yes. This is one of those hidden mechanisms of the body you just rarely think about. So, we all have these protective fat pads right beneath our skin.
Okay.
They act like biological bubble wrap for our superficial nerves. If a patient drops a massive amount of weight very quickly after bariatric surgery, that fat pad just dissolves.
So it's like stripping the physical foam insulation off a fragile pipe.
Precisely. And one of the most exposed pipes in this case is the peroneal nerve, which wraps right around the fibular head near your knee.
Oh, I see.
Without that fat pad, simple everyday actions like literally just crossing your legs or sleeping on your side can crush the nerve against the bone.
Oh, ouch.
Right. And this compression leads to a condition called foot drop, where the signal to the muscles in the front of the shin is severed, and the patient physically cannot lift the front part of their foot to walk.
That is wild. So you have this perfect storm of structural crushing and chemical starvation.
Exactly.
Now, since we brought up thiamine dropping so quickly, let's look closer at the B vitamins as a whole, because reading through this review, B vitamins really seem to be the primary currency the nervous system runs on.
Oh, absolutely. They are the fundamental building blocks of neurologic function.
Mm-hmm.
If we stick with that electrical grid analogy, B vitamins are the chemical insulation tape wrapping your nerve fibers.
Okay.
If you peel that tape away, the electrical signals start short-circuiting, bleeding out, and they just fail to reach their targets.
So let's start with thiamine, vitamin B1. We've established that the body's reserve is pretty small. When that reserve hits zero, what actually happens to the patient?
A severe thiamine deficiency causes a massive systems failure.
Yeah.
In the central nervous system, so the brain, it leads to Wernicke-Korsakoff syndrome.
Right, I've heard of that.
Yeah, the brain is essentially starved of its ability to process glucose for energy. The patient experiences profound confusion, loss of memory, and ataxia.
Ataxia being that staggering, uncoordinated gait, right?
Yes. But out in the peripheral nerves, a B1 deficiency causes a disease called beriberi.
And there are two distinct ways beriberi attacks the body, right? Wet and dry.
Yes, and that distinction is critical. Dry beriberi is a sensoromotor neuropathy.
Meaning?
Sensory, meaning you lose the feeling in your limbs, and motor, meaning you lose the physical strength to move them. It's this slow, painful degradation of the extremities.
Got it. And wet beriberi.
Wet beriberi attacks the cardiovascular system. The blood vessels lose their tension, which forces the heart to pump twice as hard, and that can rapidly lead to high-output heart failure.
Wow. And there's a terrifying detail in the research about how rapid thiamine deficiency can actually trick doctors, because it mimics a completely different, very famous disease.
Right, Guillain-Barré syndrome.
Yeah.
Guillain-Barré is a severe neurologic emergency. It's an acute autoimmune condition where the body's immune system suddenly turns on its own nerves.
So the body is attacking itself.
Exactly. And it often leads to full body paralysis and sometimes even the inability to breathe, literally within a matter of days.
That's terrifying.
It is. But what the research highlights is that a sudden sheer drop in thiamine can cause nerves to shut down so fast that it presents almost exactly like Guillain-Barré.
A paralyzing mimic. So if a doctor assumes it's an autoimmune attack and treats it with immunosuppressants, they're completely ignoring the fact that the nerves are simply starving.
Yes, and that mistake can be fatal. Because unlike Guillain-Barré, if you just replace the missing thiamine via an IV, you can rapidly stabilize the starving nerves.
Man, that's wild. Okay, let's keep moving down the B vitamin spectrum. What about vitamin B3, which is niacin?
So historically, niacin deficiency is famous for causing a disease called pellagra.
Right.
In medical school, pellagra is classically drilled into students as the triad of the 3 Ds. That's diarrhea, dermatitis, which is a really severe skin rash, and dementia.
Diarrhea, dermatitis, and dementia, the 3 Ds. But the text outlines a situation where niacin deficiency can fly completely under the radar, specifically involving patients with severe alcohol use disorder.
Yeah, this is where diagnostic medicine basically becomes a game of chess. Patients with severe alcohol use disorder frequently show up in the emergency room with encephalopathy.
Which is what? Just a broad term for altered mental status?
Exactly, general brain disease or confusion. Naturally, the standard protocol is to immediately administer thiamine.
Because doctors suspect Wernicke encephalopathy, which we just discussed?
Right, because alcoholics are notoriously deficient in thiamine.
Makes sense.
But if the patient is given thiamine and their confusion and mental status do not improve at all, the doctor has to pivot. The underlying cause of the brain dysfunction might actually be a hidden niacin deficiency.
Oh, wow.
Yeah, it requires a doctor to really know the overlapping shadows of every single vitamin.
Which naturally leads to a thought I'm sure a lot of people listening are having right now.
Oh, I bet I know what it is.
Right, like if a lack of these B vitamins causes your brain to fail and your nerves to short circuit, the logical modern solution is just to take a massive handful of multivitamins every morning. Like, if a little is essential, a lot must be a superpower, right? We can just biohack our way to an invincible nervous system.
It is such a common thought process today, but the answer is an emphatic, hard no.
Really?
Attempting to artificially overcompensate with massive doses of supplements has birthed this terrifying modern phenomenon of toxic neuropathies.
Wow.
More is absolutely not better. When it comes to certain vitamins, flooding the engine is just as destructive as starving it.
And the prime example of this is vitamin B6, also known as Pyridoxine.
Vitamin B6 is a perfect paradox. Your body absolutely needs it. A deficiency will cause anemia and peripheral neuropathy.
Right.
But if you take that exact same vitamin in excessive amounts, and we're talking about doses of maybe 100 to 200 milligrams per day for prolonged periods, it literally becomes a neurotoxin.
A neurotoxin just from a vitamin.
Yes. It causes a severe condition called sensory ganglionopathy.
Okay, let's unpack that term. Ganglionopathy. A ganglion is a cluster of nerve cell bodies, right? So taking too much B6 is literally seeking out and destroying these nerve clusters.
It is. Specifically, it destroys the dorsal root ganglia. These are crucial clusters of sensory nerves located just outside your spinal cord.
Okay.
They're basically the grand central station for sensory information traveling from your limbs into your brain. When excess B6 destroys these clusters, it leads to sensory ataxia.
Which means your brain loses its internal GPS. It no longer knows where your limbs are in space unless you are physically looking at them.
Yes, that internal GPS is called proprioception. Without it, patients lose their reflexes, and they exhibit what neurologists call a positive Romberg sign.
Wait, the Romberg sign, that's the test where the doctor asks you to stand with your feet together, put your arms out, and close your eyes, right?
Exactly. And if you immediately sway or topple over, that is a positive Romberg sign.
Oh, I see.
Because when your eyes are open, your brain is using visual cues to keep your balance. But the moment you close your eyes, your brain relies entirely on the signals from the nerves in your feet and legs to know how to stand upright.
But the B6 destroyed the hubs.
Right. Because the B6 toxicity has destroyed the dorsal root ganglia, those signals are just gone. You close your eyes and you fall.
Man, and this kind of profound, irreversible damage can be caused just by taking too many over-the-counter supplements that literally anyone can buy at a grocery store.
Yep. It is deeply sobering.
It really is. And it isn't just vitamins that can cause this sabotage. Let's talk about minerals, specifically zinc overload.
Zinc toxicity operates on this fascinating, almost devious mechanism.
How so?
If you take massive amounts of zinc, the zinc itself doesn't necessarily attack your nerves. Instead, it acts as a blockade.
A blockade for what?
For copper. Excess zinc stimulates the production of a protein in your gut lining that aggressively binds to copper. It traps the copper inside the intestinal cells, which eventually just die and are excreted.
So the zinc is essentially standing in the doorway, preventing any copper from entering the bloodstream.
Exactly.
You are chemically inducing a copper deficiency by taking too much zinc.
Yes. And the real world scenarios where people encounter this zinc overload are wild.
Like what?
Well, overzealous use of zinc supplements during cold and flu season is a major one. But the review also points out that for decades, denture adhesive creams contained massive amounts of zinc.
Wait, denture cream?
Yeah. People using large amounts of this cream to keep their dentures in place were inadvertently swallowing huge doses of zinc every single day.
So a patient's unexplained nerve pain could literally be traced back to their dental adhesive. It's incredible. And you mentioned swallowing pennies earlier.
Yes, there are documented medical cases of psychiatric patients or even children swallowing coins.
Right.
Pennies minted in the United States after 1982 are primarily made of zinc with just a thin copper coating. So as the stomach acid breaks down the coin, it releases a massive surge of zinc, triggering this exact same copper blockade.
Unbelievable. Which I think is the perfect bridge to our next concept. Because when zinc blocks copper and you develop a copper deficiency, you enter the territory of what the review calls the great mimic.
Yeah.
Right, because a copper deficiency looks clinically identical to the most famous nutritional neuropathy of all, vitamin B12 deficiency.
They're absolute clinical twins. If a doctor examines a patient with a copper deficiency and another patient with a B12 deficiency, the physical presentation is often completely indistinguishable.
So if they look exactly the same to the doctor, what is actually happening inside the patient's body? We established that myelo refers to the spinal cord and neuro refers to the peripheral nerves, and the review states both deficiencies cause a myeloneuropathy.
Right, which means the damage is happening on two distinct fronts simultaneously. Both the central highway of the spinal cord and the local roads of the peripheral nerves are taking damage.
Okay.
Medically, the spinal cord damage is called subacute combined degeneration.
And how does that dual front damage actually feel to the person experiencing it?
Usually, it starts with a concomitant hand and foot paresthesia.
Which is?
That's the medical term for a burning, tingling, or pins and needles sensation happening in the hands and feet at the same time. But the true hallmark reveals itself during a physical exam because of this bizarre reflex mismatch.
Wait, a mismatch because the spinal cord and the peripheral nerves are basically fighting each other?
Precisely. Because the peripheral nerves in the legs are damaged and dying, you would expect the doctor's reflex hammer to get no response, right?
Right, a dead reflex.
But because the spinal cord is also damaged, its normal inhibitory controls are gone. It starts firing hyperactive panic signals.
Oh, wow.
So you end up with brisk, overactive knee jerks combined with absent, entirely dead ankle reflexes.
Central damage driving hyperreflexes and peripheral damage causing dead reflexes all in the same leg.
Exactly. And another classic hallmark of this dual damage is the Lermit sign.
What's that?
If the patient simply bends their neck forward, tucking their chin to their chest, they experience a sudden, violent electrical shock sensation that shoots down their spine and radiates out into their arms and legs.
Wow, that sounds awful.
It is. It's a defining indicator that the dorsal columns in the spinal cord are degrading.
Now, when we were discussing bariatric surgery earlier, we noted that it can take 4 to 5 years for a B12 deficiency to actually show up in a patient.
Yes.
If B12 is so critical that losing it literally dissolves the spinal cord, why does the body take so long to raise the alarm?
It actually has to do with evolutionary survival. Vitamin B12 is incredibly complex, and historically, it was difficult for humans to forage in large amounts.
Okay.
So the body designed a doomsday bunker for it. Your liver stores a massive reservoir of B12. If your digestive tract suddenly lost the ability to absorb a single microgram of B12 today, your liver would keep your nervous system running on its emergency reserves for up to 5 years before the engine finally seized.
That is incredible foresight by the human body. But, bariatric surgery isn't the only thing that shuts down B12 absorption. The text points out that this is wildly common in older adults due to a completely different mechanism.
Right. It's driven by a condition called atrophic gastritis.
Which means?
Well, as we age, the stomach lining can thin and degrade, which means it produces significantly less stomach acid. When you eat meat or dairy, the B12 is tightly bound to animal proteins. You need strong stomach acid to dissolve that protein and set the B12 free so it could actually be absorbed.
Oh, I see. So without the acid, the B12 just stays locked in its protein cage and passes straight through the digestive tract.
Yep.
The person is eating plenty of meat, but they're starving for B12.
It's called food-bound B12 malabsorption. The food is there, but the key to unlock it is gone.
Which brings us to the final and perhaps most alarming section of this deep dive. Because it is one thing if your body can't unlock a vitamin or, if you artificially block it with zinc. It is another thing entirely when we actively consume chemicals that seek out and destroy the vitamins we already have.
We are talking about chemical saboteurs. And one of the most clinically relevant right now is nitrous oxide.
Better known as laughing gas at the dentist or recreationally used in whippets. How does a gas destroy a vitamin?
The chemistry is incredibly precise. At the center of every vitamin B12 molecule is a cobalt core. When a person inhales nitrous oxide, the gas chemically oxidizes that cobalt core.
Okay.
It essentially rusts the core out, changing its valence state.
So it neutralizes it.
It completely deactivates it. The B12 molecule is rendered functionally dead. And this creates an absolute nightmare for doctors.
Why is that?
Well, if a patient comes in with severe nerve damage from inhaling laughing gas, the doctor will likely draw blood to check their B12 levels.
But dead B12 is still floating in the blood.
Exactly. The blood test only measures the amount of the molecule, not whether it is active. The blood work comes back perfectly normal. So the doctor rules out a B12 deficiency, while the patient's spinal cord continues to undergo subacute combined degeneration from a severe functional lack of B12.
Normal blood work, but your nerves are dying because the vitamin is a zombie. That is a terrifying mechanism.
It really is.
Let's look at another saboteur that is far more common: alcohol. The review connects severe alcohol use disorder directly to neuropathy. But there's a fascinating chicken or egg debate here, right? Is the alcohol itself killing the nerves, or is it the terrible diet that usually accompanies heavy drinking?
The research indicates it's actually a devastating dual-front assault. Alcoholic neuropathy usually presents as a slow, agonizing, small fiber neuropathy.
Okay.
On one front, you have severe malnutrition. People with severe alcohol use disorder often consume the majority of their daily calories as pure ethanol, which has zero nutritional value.
Right.
This leads to massive thiamine and folate deficits. But on the other front, ethanol and its metabolic byproducts are directly chemically toxic to nerve fibers.
So you are starving the nerve while simultaneously poisoning it. Man. Now, for our final hidden saboteur, we have to talk about celiac disease. Most of us associate celiac entirely with the gut. You eat gluten, your immune system freaks out, and you get severe cramping, bloating, and diarrhea.
Sure.
But the review highlights a massive silent danger here.
This is perhaps the most crucial takeaway for anyone dealing with mysterious nerve issues. Celiac disease essentially turns your own immune system into a wrecking ball inside your gut.
The immune-mediated enteropathy.
Right. When you consume gluten, your immune system aggressively attacks the lining of your small intestine, blunting the tiny structures that absorb nutrients, which leads to widespread starvation of vitamins and minerals.
Right, but the hidden danger is that this starvation doesn't always come with stomach pain, does it?
No, it doesn't. Celiac disease can cause profound, debilitating neurological issues, specifically ataxia, the loss of coordination, and severe peripheral neuropathy, even in patients who have absolutely zero gastrointestinal symptoms.
None at all.
No cramping, no bloating, no diarrhea.
So the gut is silently failing, and the first alarm bell rings in the feed.
Exactly. The neurological breakdown can be the primary or even the only clinical sign of the disease. If a doctor is trying to diagnose an unexplained neuropathy, relying on a patient's history of stomach aches will cause them to miss celiac entirely.
Wow.
Screening for celiac antibodies in the blood is often a necessary step for unexplained nerve damage.
When we pull all of this together, from the hidden consequences of stomach surgery to the zinc in pennies to the oxidized B12 from laughing gas, it paints a picture of the nervous system that is so much more fragile and so much more complex than just, getting a pinched nerve.
Oh, completely.
If you or someone you know is dealing with mysterious numbness, tingling, or a sudden loss of coordination, the answer might not be a mechanical injury on an X-ray. It requires zooming out and looking at the entire physiological supply chain.
It absolutely does. It requires investigating your history of gastric surgeries, the medications and supplements you take daily, your alcohol consumption, and the hidden health of your gut lining. Because the root cause of nerve damage is very often a failure of supply, not a physical trauma.
Which leaves us with a lingering thought to carry forward. We've spent this time unraveling how easily the nervous system's supply chain can be disrupted. But think about the standard neurological exam today.
Right.
When you complain of numbness, a doctor will test your reflexes, maybe order an MRI or conduct nerve conduction studies to see how fast the electricity is moving. But given everything we now know about how profoundly nutrition dictates nerve health, how a lack of B vitamins or copper can literally dissolve the spinal cord, is our diagnostic baseline backwards?
That's a great question.
Should a comprehensive deep dive nutritional and gut absorption panel be the very first thing we check before we ever pull out a reflex hammer or schedule an MRI? If the wires are fundamentally starving, maybe we should stop testing the voltage and start checking the soil.
It definitely makes you rethink the standard protocol.
It makes you wonder how many unexplained neuropathies are just waiting for the right blood test. Until next time, keep questioning the obvious.